Okay, so we are moving through the LTCH CARE Data Set. Now we are going to do Section O, Special Treatments, Procedures, and Programs. And I'm going to be talking a lot about the two new ventilator liberation quality measures and the associated data elements. That'll be the majority of this presentation, but we'll also go over some of the other items in Section O. The next two slides show the list of acronyms that will be used in this presentation. I want to let you know that I'll be using the terms ventilator liberation and ventilator weaning interchangeably. I'm also going to refer to spontaneous breathing trial as an SBT because there is a lot of words in our measures. So in terms of what's going to be presented in the next hour or 45 minutes is the two new ventilator liberation quality measures. We'll also talk about the intent, the overall intent of Section O. I'll go over the new items and changes. We'll discuss coding instructions, and then we will also have scenarios that you'll have an opportunity to code. At the end of this presentation, you should be able to define the components of the ventilator liberation quality measures, state the intent of the changes to Section O, articulate the purpose of the coding options for each new item, and apply coding instructions to accurately code practice scenarios. The intent of Section O is to identify any special treatments, procedures, and programs that the patient received during the LTCH stay, including spontaneous breathing trial for ventilator liberation and IV vasoactive medications. You should also be able to present or articulate the ventilator liberation items. And as been previously mentioned on one of the earlier slides, the influenza vaccination items remain unchanged and are discussed in a separate presentation tomorrow, summarizing minimal changes to the LTCH CARE Data Set. So I'm going to begin by talking about the new items in Section O. And the first one is O. 0100H IV medications, and the specific data element, there's two elements here, O0100H2A vasoactive medications. And this is one of the new items you'll be asked to complete at the admission assessment. And specifically, you're going to be coding when your patient is on IV vasoactive medications. And the reason that we're adding this is I talked about risk factors in my previous presentation regarding the ventilator liberation measures. This is also a risk factor, a risk adjuster for these particular for the outcome measure for ventilation. On the admission assessment associated with the ventilator liberation quality process measure is a new item, O0150, spontaneous breathing trial, or SBT, by day 2 of the LTCH stay. And you'll see that you have 5 responses here. I'm not going to go over them now because I'm going to be going over them in detail in a few minutes. The other section, data element in Section O, relates to the ventilator liberation outcome measure, and this is O0200, ventilator liberation rate. And this is the new discharge assessment data element associated with the ventilator liberation outcome quality measure. The next slide goes over new items and changes. What has been removed from version 3.0 of the LTCH CARE Data Set is, as I finally refer to them as F3 and F4, which are invasive mechanical ventilator weaning and non-weaning. So those have been removed from version 4.0, and they've been replaced by this new data element, 00150A, invasive mechanical ventilation support upon admission to the LTCH. And again, I'll be going over these in more detail. The next several slides present the ventilator liberation quality measures to provide context for the new data elements associated with these measures. The Donabedian model of structure, process, and outcome provides a framework for the ventilator liberation measures. The structure component is the patient as admitted to the LTCH. The process component is related to initiating liberation from the ventilator. And this is the process measure, which is compliance with spontaneous breathing trial by day 2 of the LTCH stay. The outcome component of the model is the end result of the patient due to the care received at the LTCH, and the outcome measure is ventilator liberation rate. This slide depicts the 2 ventilator weaning process and outcome measures. So in the first circle, you have the process measure. And the first measure is compliance with spontaneous breathing trial by day 2 of the LTCH stay, which includes tracheostomy collar or continuous positive airway pressure, CPAP. And this measures the facility level compliance with the SBT by day 2 of the long-term care hospital stay for patients on invasive mechanical ventilation support upon admission. And a key point is, and for whom at admission weaning attempts were expected or anticipated. There are 2 components to the process measure. The first one is the percentage of patients assessed for readiness for an SBT by day 2 of the LTCH stay. And the second component is the percentage of patients ready for an SBT who received an SBT by day 2 of the LTCH stay. Patients included in component 2 comprise a subset of the population in component 1. While all patients admitted on invasive mechanical ventilation are included in the denominator for component 1, only those patients who were found ready for SBT are included in the denominator for component 2. The second circle on this slide is the outcome measure, the ventilator liberation rate. And this is the percentage of patients who are alive and fully liberated at discharge from the LTCH. This slide shows the denominator exclusion for the vent measures, and they are patients that are not on invasive mechanical ventilation support, and you see the code here, which I will go in more detail in a few minutes. The other exclusion criteria is patients on invasive mechanical ventilation support who were not weaning or non-weaning at the time or expected to be weaned at the time of their admission. The measure will be calculated quarterly using a rolling 12 months of data. All LTCH stays, except those that meet the exclusion criteria, are included in the denominator and are eligible for inclusion in the numerator. For patients with multiple stays, each stay is eligible for inclusion in the measure. The next few slides, I'm going to break down each one of the components of the process measure. So the way to read this particular slide is that the two circles that are above the dark line are the numerator, and the circles below the line are the denominator, very similar to what Carol described in terms of the drug regimen review measure. So the numerator is the number of patients who were assessed as medically ready for an SBT by day 2 of the LTCH stay, plus the number of patients with documentation that were assessed as not medically ready for SBT by day 2 of the LTCH stay. The denominator includes those patients admitted to the LTCH on IMV that have any possibility of liberation, and includes all patients admitted on IMV support for any duration during the reporting period, minus patients for whom weaning attempts were not expected or anticipated at admission. This ventilator quality process measure is important for encouraging implementation of evidence-based weaning guidelines through implementation of trials of unassisted breathing and early assessment of weaning criteria in order to decrease LTCH patient exposure to adverse ventilator-associated morbidity and mortality. The anticipated improvement in quality is an improvement in timeliness of weaning and ventilator liberation for patients admitted to LTCHs on invasive mechanical ventilation. It is also hoped that facilities will be able to use the results from this measure to improve early compliance with evidence-based weaning guidelines and develop ventilator weaning quality improvement programs. If a patient has more than one LTCH stay during the reporting period, each discharge will be reported and included in the measure calculation. Denominator exclusions include patients with missing data, an invasively mechanically ventilated patient identified as non-weaning at the time of admission to an LTCH, patients who may be identified as non-weaning by LTCHs include patients who are considered chronically ventilated as defined by evidence-based guidelines for ventilator liberation. Or it may be patients with an acute or chronic condition that negates any expectation or anticipation of weaning attempts at admission. So examples of that might be amyotrophic lateral sclerosis, patients with severe neurological injury or disease or dysfunction such as high C2 spinal cord injury. We know that there are exceptions, and there have been great cases where patients that have these severe neurological injuries at times are able to be liberated, but this is just to give you some examples of patients that are generally considered non-weaning. And the other important piece is that consideration of a patient as non-weaning must be based on documentation found in the patient's medical record. So that's component 1. Component 2 of the process measure is the percentage of patients ready for SBT who received the SBT by day 2 of the LTCH stay. The numerator is the number of patients who received an SBT by day 2 of the LTCH stay. The denominator is the number of patients who were deemed medically ready for SBT by day 2 of the LTCH stay. So that summarizes the process measure. The next slide, this slide, shows the numerator and denominator for the ventilator liberation outcome measure, percentage of patients who are alive and fully liberated at discharge. The ventilator weaning rate assesses the proportion of patients discharged alive from an LTCH who are fully liberated or weaned. It reports the facility-level ventilator weaning liberation rate for patients on IMV support upon admission to the LTCH. A patient is considered fully weaned if he or she does not require any invasive mechanical ventilation support for at least 2 consecutive calendar days immediately prior to the date of discharge. Patients are excluded from the target population or the denominator if they meet either of the following criteria. And again, I'm going to go over the specific data elements, but for O0150A, spontaneous breathing trial, if that is selected as no, not on invasive mechanical ventilation support, they're excluded. Or if the patient selects the response, yes, the provider selects the response, yes, non-weaning, meaning no weaning attempts are expected or anticipated at admission. As I previously stated, this measure is intended to promote weaning efforts and encourage quality management quality improvement of LTCH patients on mechanical ventilation. Patients, an important point also is patients who are considered non-weaning at admission are excluded from both measures. The next slide summarizes the risk adjusters for the outcome measure. And as you can see, the first category involves the functional abilities and goals, and the risk adjuster is GGO 100B, prior functioning, everyday activities, indoor mobility, ambulation. The active diagnosis I went over in the previous presentation, but it's the 2 cancer active diagnosis, the new heart circulation, and several neurologic active diagnosis, and then the post-transplant comorbidities and coexisting conditions that we already talked about. And then from Section O, special treatments, procedures, and programs, as we've already talked about, the vasoactive medications, and then also dialysis is going to be used as a risk adjuster. In the next several slides, I will present the coding guidance, and you will have the opportunity to participate in coding clinical scenarios for Section O. So we're going to start back at the beginning of Section O, and then we'll get into the more specific ventilator coding. So O0100 is the first data element that you will be asked to code on the admission assessment. The non-invasive ventilator data elements, which include BiPAP and CPAP, are familiar to you and are current on the data set version 3.0. Under the other treatments category, HIV medications is new, as is H2A, vasoactive medications, which are continuous infusions of vasopressors and inotropes. And I'll go over that coding in a few minutes. The remaining data elements in this section are familiar to you and have not changed. And Z, none of the above, is also familiar to you and has not changed. These data elements in Section O are included as the treatments, procedures, and programs listed can affect the patient's ability to liberate from invasive mechanical ventilation and or perform self-care and mobility activities. As with all data elements in the long-term care data set, you are going to review the patient's medical record to determine whether or not the patient received or performed any of the treatments, procedures, or program during the 3-day assessment period. A specific example for dialysis, you're going to check dialysis if it is part of the patient's treatment plan, and this is not new to this section. The next section is respiratory treatments. O0100G, non-invasive ventilator, BiPAP and CPAP, and this includes any type of continuous CPAP or bi-level positive airway pressure, BiPAP, respiratory support devices. Patients have masks, as you know, that enable them to support his or her own respiration. This item is coded if the patient puts on or removes his or her own BiPAP CPAP mask, or if the LTCH staff applies it for the patient. So there's no change in this particular section. Moving on to other treatments, what is new are, as I've mentioned several times now, IV medications and O0100H2A, vasomedications. And so you're going to check this one if the patient received any intravenous vasoactive medications. The dialysis data element has not changed, nor has the total parenteral nutrition item changed, and you're going to select that if the patient receives IV, parenteral or IV feeding. And again, this is not a change as well. You would check none of the above if your patient is not receiving any of these treatments or programs. Okay, so we'll go on to the first practice scenario. Mr. G is a 62-year-old former smoker who is diagnosed with chronic obstructive pulmonary disease. He is dependent on 3 liters per minute of oxygen at home. He suffers from chronic carbon dioxide retention. He was recently prescribed a BiPAP ventilator at night to assist him with eliminating CO2. Mr. G used the BiPAP device until he started to feel congested and had increased sputum production. The symptoms persisted until he was taken to the emergency department. Mr. G was admitted to the ICU requiring intubation and mechanical ventilation for 96 hours. Mr. G recovered and is admitted to the LTCH to optimize his BiPAP settings and receive therapy services to improve his activities of daily living. Although Mr. G can use his BiPAP independently, he requires some guidance and coaching to use his BiPAP device properly and consistently. How would you code this data element? – 100%, excellent. That is the correct answer. And it's correct because Mr. G has been prescribed BiPAP and wears the mask nightly to manage his COPD. I'm going to run through these fairly quickly because I really want to get to the ventilator liberation data elements and scenarios. So the second scenario, Mrs. L developed acute renal failure related to excessive use of nonsteroidal anti-inflammatory drugs. For her arthritis, she receives hemodialysis 3 times per week. How would you code this scenario? Okay, again, 100%, excellent. I think this is self-explanatory. Her treatment plan includes dialysis. The next scenario, Mrs. C has been unable to eat or ingest adequate nutrients since her bowel surgery. She receives TPN using a peripherally inserted central catheter, PICC line, that infuses her nutrients 24 hours daily. How would you code this scenario? You're very quiet. There's no discussion, so I think we can move on. And that is the correct answer. Again, I think it's self-explanatory. She's receiving TPN as part of her treatment plan. Okay, one more scenario in this area. Mr. D is being treated for a hemorrhagic stroke. He does not require mechanical ventilation, IV vasoactive medications, dialysis, or TPN. How would you code this scenario? That is correct. You're going to check none of the above. He does not require any of these special treatments, procedures, or programs as described. Okay. Mrs. J was admitted to the LTCH recovering from septic shock and is on invasive mechanical ventilation. Her blood pressure was stable upon admission to the LTCH. On the second day of her hospitalization, her blood pressure decreased to 80 over 50, and norepinephrine was administered via central venous catheter to treat her hypotension. How would you code this scenario? Okay, 71% selected D, both A and B, IV medications and vasoactive medications. That is the correct response. Thank you. So I'm sorry I didn't go over the rationale, but the rationale you check both because we've asked you to check off the, I'll call it the parent item, the IV medications, and then the data element of vasoactive medications. Okay, so now we're going to move on to okay, so this is a screenshot of what the LTCH CARE Data Set version 4.0 looks like for the process measure, spontaneous breathing trial by day 2 of the LTCH. And I'm going to walk you through each of these data elements. So these data elements are included in the long-term care data set because they document the use of invasive mechanical ventilation support upon admission to the LTCH, and also the implementation of the SBT by day 2 of the LTCH stay. These data elements also document the facility's implementation of evidence-based weaning guidelines that occurred as early as is beneficial to the patient during the LTCH stay when the patient is assessed as a candidate for weaning upon admission. So for this data element, this new data element, 00150A, you have 3 coding responses to choose from. So the first one is 0, no, and you're going to check this one if the patient is not on invasive mechanical ventilation support upon admission to the LTCH. If you code this data element as no, this ends the data collection for 00150. In other words, all 5 of those responses that you saw in the previous, or all 4 of the previous responses in the screenshot. You're going to skip to the influenza vaccine data elements if you code this as no. The next choice you have for a response is 1, yes, weaning. You're going to select this one if the patient has any type of electrical or pneumatic closed system mechanical ventilation device that delivers oxygen to a patient who is unable to support his or her own respiration and for whom weaning attempts are expected or anticipated at the time of the admission. If you select this data element as 1, yes, then you continue to the next data element, 00150B, which is assessed for readiness by SBT by day 2 of the LTCH stay. I want to emphasize that this item is checked as yes if the patient is on invasive mechanical ventilation upon admission to the LTCH, and also at the time of admission, it is expected or anticipated that the patient will be able to wean from the ventilator. The third response option you have for this item is code 2, yes, non-weaning. You're going to select this response if the patient has, again, same kind of ventilation that I just described for the previous code, but this one is non-weaning for whom weaning attempts are not expected or anticipated at the time of admission. So for instance, patients who are chronically ventilated in the community or at a facility, or who have progressive neuromuscular disease such as ALS, diagnosis that I mentioned earlier, these might be patients that are considered or not expected or anticipated to wean at the time of admission. If you code to yes, non-weaning, this also ends the data collection for 00150. And you're going to skip to the influenza vaccine items. Patients receiving closed system ventilation include those patients receiving ventilation via tracheostomy and those patients with an endotracheal tube. That endotracheal tube may be either oral or through the nose. Documentation in support of this item should be recorded and dated by the day 2 of the LTCH stay, where day 1 is the day of admission. If item 00150A is marked either no or yes, non-weaning, then completion of items 150B through 150E is not required for the patient. If 150A is marked yes, weaning, then you are going to proceed to item 150B. And here we have 150B. So the next data element is 150B, and this is where you're going to assess for readiness for spontaneous breathing trial by day 2 of the LTCH stay. Note, day 2 equals the date of admission to the LTCH, as I said, day 1 plus 1 calendar day. In this item, you have a response, you can code 0, no, if the patient was not assessed for readiness for an SBT by day 2 of the LTCH stay. If you code this item as 0, no, this ends the data collection for 0150. And again, as I mentioned, you're going to skip then to the influenza vaccine items. If you code this data element as yes, it means that the patient was assessed for readiness for a spontaneous breathing trial by day 2 of the LTCH stay. If you code this item as yes, then you are going to proceed to item 150C to ask the question, was the patient deemed medically ready for SBT by day 2 of the LTCH stay? If item 150B is marked no, items 150C through 150E are not required for the patient. You're going to skip to the influenza vaccine items. If 150B is marked yes, then as I already said, you're going to proceed to item 150C. Item 150C is the data element, is the patient medically ready for SBT by day 2 of the LTCH stay. You're going to code this data element no if the patient was not deemed medically ready for SBT by day 2 of the LTCH stay. If you code this data element no, you will continue to 150D. Is there, in 150D is there documentation of the reason or reasons in the patient's medical record that the patient was deemed medically unready for SBT by day 2 of the LTCH stay? You'll code this data element yes if the patient was deemed medically ready for SBT by day 2 of the LTCH stay. If you code this data element yes, then you will proceed to 150E. The spontaneous breathing trial was performed by day 2 of the LTCH stay. The next data element is 150D, and this is there documentation of reasons or reasons in the patient's medical record that the patient was deemed medically unready for SBT by day 2 of the LTCH stay. You're going to code no if there is no documentation of the reason that the patient was deemed medically unready for SBT by day 2 of the LTCH stay. You'll skip to, if you code this one as no, you'll skip to the influenza vaccine data elements. If you respond yes, if there is documentation that the patient was deemed medically unready for SBT by day 2 of the LTCH stay. And you also, if you complete this response, you'll skip to the influenza vaccine. So it's really important that there's documentation in the medical record around the patient being deemed medically ready for SBT and vice versa, that the patient is not deemed medically ready for SBT. For item 150D, documentation in the medical record indicates explicit physician, registered nurse, or respiratory therapist documentation of a reason that a patient was not deemed medically ready for SBT by day 2 of the LTCH stay. The last data element in this section asks you if the SBT was performed by day 2 of the LTCH stay. You're going to code no if the SBT was not performed by day 2 of the LTCH stay, or you're going to code 1 yes if an SBT was performed by day 2 of the LTCH stay. Only one item, either 150D or 150E, should be coded. The response to item 150C determines which one of these items is coded on each patient's assessment. So now let's practice some coding scenarios. In this first scenario, you'll be asked to code the patient's ventilator status upon admission to the LTCH on the admission assessment. Ms. K is a 32-year-old female who is being discharged from the acute care hospital after an acute episode of respiratory failure secondary to pneumonia. Ms. K was diagnosed with cystic fibrosis and has had recurrent respiratory infections over the course of 6 months. Ms. K was intubated in the emergency department and transferred to the intensive care unit where she was treated for her pneumonia. After several failed attempts to wean and extubate, Ms. K underwent surgery for placement of a tracheostomy tube. She remains fully ventilated and is being transferred to the LTCH for weaning. Ms. K was admitted to the ventilator weaning unit where she is expected to liberate from mechanical ventilation. This is recorded in her discharge summary as well as her care plan from her admission to the LTCH. How would you code 00150A? So your options are no, not on invasive mechanical ventilation support, 1, yes weaning, or 2, yes non-weaning. And this is related to invasive mechanical ventilation support upon admission to the LTCH. (96% selected B, 1 yes weaning. That is the correct answer. And this is Ms. K was on invasive mechanical ventilation upon admission to the LTCH, and it was documented in her care plan that she is expected to liberate from mechanical ventilation. The next scenario this will speak to whether the patient is deemed medically ready for SBT. Ms. T is a 32-year-old female with cystic fibrosis. She was discharged from the ICU yesterday and admitted to the ventilator weaning unit at the LTCH. She had a stable first night and transitioned from the ICU ventilator to the LTCH ventilator without issue. She understands that she passed the SBT criteria and is medically stable and ready to transition to spontaneous breathing trial via a tracheostomy mask. The registered nurse and respiratory therapist coordinated the trial for SBT to begin when Ms. T is finished with her routine morning care. How would you code 00150C? Was the patient deemed medically ready for SBT by day 2 of the LTCH stay? Okay. And the correct answer is yes. She was deemed medically ready for the SBT by day 2 of the LTCH stay. And the rationale for this is that she passed the SBT criteria and is medically stable and ready to transition to spontaneous breathing trial via tracheostomy mask. I am going to skip the next scenario because we have less than 4 minutes left, and I really want to get to the ventilator liberation outcome data element. Okay. The other new data element in this section is 00200 ventilator liberation rate. So this is associated with the outcome quality measure for ventilator liberation, and this is on the discharge assessment. The data element applies to the planned and unplanned discharge assessments, and you are asked to code the patient's liberation status at discharge. This slide shows this item is used to determine the facility's rate of discontinuation of invasive mechanical ventilation, which is used to calculate the ventilator liberation quality measure. You have 3 choices for coding 00200 ventilator liberation rate. You're going to code this data element 0, not fully liberated at discharge, if the patient required partial or full invasive mechanical ventilation support within 2 calendar days prior to discharge. You're going to code this data element 1, fully liberated at discharge, if the patient did not require any invasive mechanical ventilation support for at least 2 consecutive calendar days immediately prior to discharge. You will code 9 NA if this item does not apply. So this code only applies, NA, if the patient was non-weaning or not on invasive mechanical ventilation support on admission. So this means going back to the admission process measure data elements, 0015A equals 2, yes, non-weaning, or 0, not on mechanical ventilation upon admission to the LTCH. You can see how this data element corresponds to the first data element of the admission assessment. I'd like to make a point of emphasis in terms of this coding tip. To code 1, fully liberated at discharge, the patient must not require any IMV for at least 2 consecutive days immediately prior to discharge. I have been asked out in the community if fully liberated within this time frame includes decannulation. The answer to this question is no. The patient needs to be free of invasive mechanical ventilation at least 2 consecutive days immediately prior to the discharge, but is not required to be decannulated. Okay, we have 51 seconds. We're going to get in a scenario here. So the next coding scenario illustrates how to code this data element. Ms. K is a 32-year-old female who is being discharged from the LTCH to a skilled nursing facility. She was admitted to the ventilator weaning unit after her ICU stay at an acute care hospital. Mrs. K was diagnosed with cystic fibrosis complicated by multiple recurrent respiratory infections, and she had a tracheostomy tube placed while at the acute care hospital after she failed several attempts to liberate from mechanical ventilation. While at the LTCH, Ms. K successfully liberated from mechanical ventilation. She will be discharged to a skilled nursing facility for tracheal decannulation. She has not required invasive mechanical ventilation for at least 2 consecutive days immediately prior to the discharge. How would you code 00200A, invasive mechanical ventilator liberation status at discharge? Okay, excellent. 96% selected code 1, fully liberated at discharge. And the reason that this is the correct answer is that Ms. K did not require invasive mechanical ventilation for at least 2 consecutive calendar days immediately prior to discharge and was fully liberated at discharge. I would like to make a note that one of your response categories was to enter a dash, but I just want to point out to you that if a dash is used for any of these data elements, O0150A through E and O0200A, these are values that may count against your annual payment update. Can I do one? I'm going to do one more. Anila's shaking her head. Okay, thank you, Anila. Let's do one more. Mrs. F was admitted to the LTCH. I like talking about this measure, as you can tell. Mrs. F was admitted to the LTCH with a diagnosis of hypercarbic hypoxemia respiratory failure secondary to a COPD exacerbation. While Mrs. F was in the ICU, she underwent 2 attempts to wean fully from the ventilator and had 2 unsuccessful trials of BiPAP post-extubation. She was admitted to the LTCH with the expectation of fully liberating from invasive mechanical ventilation. Despite several attempts to wean her from the ventilator, she was unable to maintain normal partial pressure of carbon dioxide in arterial blood, in other words, her PaCO2, levels for greater than a few hours. She remained fully ventilated until the time she was discharged to the acute care facility with sepsis. How would you code O0200A? And you have the options of not fully liberated, non-applicable, or a dash. That, excellent. That is the correct response, not fully liberated at discharge. Okay, one more. This is the final coding scenario in this presentation. Mr. G was diagnosed several years ago with ALS. He has been managing his respiratory system adequately using a non-invasive ventilator. Over the past 2 months, it has become increasingly difficult for him to maintain ventilation using a non-invasive ventilator in the home without developing pneumonia and atelectasis. He was recently admitted to an ICU at an acute care hospital for elective surgery to place a tracheostomy tube and subsequently be placed on full invasive mechanical ventilation. After his 3-day stay in the ICU, he was stable on appropriate ventilator settings and transferred to the LTCH to prepare his family and caretakers to care for his needs in the home setting. How would you code O0200A in this scenario? 67% selected C, non-applicable, another 33% selected not fully liberated at discharge. And as you can see, the correct answer for this scenario is not applicable. And it's not applicable because he was on invasive mechanical ventilation, but he was determined to be non-weaning upon admission to the LTCH due to his medical condition. So that's a really important distinction about how you would use non-applicable. So Mark is to my right, and so in summary, I've presented the two ventilator liberation quality measures. We've talked about the data elements associated with that. We've also talked about the other changes to Section O, particularly IV vasoactive medications and how to code that. And then in terms of the action plan, my suggestion would be to start with talking with your staff about the ventilator quality measures. You'll be having a presentation tomorrow about where all the resources are located for the LTCH QRP. The measure specifications will be on one of those websites, and that's a place you can start looking at the measures. And then I would suggest that you develop scenarios or use these scenarios to practice with your staff coding the data elements, particularly for these two new measures. I apologize for going over and keeping you from lunch, but I thank you for your attention and the extra time.